Hello everyone, my name's Chia. I'm the president of the Rural Health Club at Charles Sturt University. So this resource is brought to you from Rural Health Positive, and we're a Charles Sturt University club, and it's our way of giving back to those that helped us along the way. The students you will hear from later are all current students in health courses at Charles Sturt who were once upon a time in your current situation to say, you know what, it's okay. It's okay to be confused, but everything will work out more than fine. Enjoy, and we welcome you to CSU and thrive and join the missions towards better health for our rural and remote communities.
My name's Erin. I'm studying Bachelor of Medical Radiation Science, specialising in medical imaging.
I'm Georgia. I'm in my second year of paramedicine studying at Port Macquarie.
My name's Jeraldine Paramedicine. I am doing the postgraduate clinical diploma of paramedicine by distance.
My name is Neema Dentistry. I'm studying Bachelor of Dental Science and I'm in my first year.
I'm Sam and I'm studying Podiatry. I'm about halfway through my fourth year and I'm studying at the Albury-Wodonga campus.
Hi, I'm Tara and I'm studying a Bachelor of Speech and Language Pathology at CSU in Albury.
Hi, my name's Zoe Watson. I'm a second year dentistry student at Charles Sturt Orange.
My name is Rachel. I'm studying my Bachelor of Nursing. I'm on my first year and I'm based at Wagga campus.
I love the variety in the degree. So we take plain x-rays, we do CT, MRI, go up into theatre.
So paramedicine's pretty cool. It's very, very hands-on.
There's a lot of stuff around sort of sports medicine, if that's your kind of interest. I know that's what a lot of people like doing with it.
Like we deal with kids with speech difficulties, kids with disabilities, adults with disabilities. Like there's so much that I never knew that speech pathologists did. And so that's something that I found really cool.
I definitely love learning about the human anatomy. That subject I'm finding really interesting just because it is what we are. So it's just really cool to find out more information. And also the pracs, they were really interesting, getting a bit of experience in the field.
I applied via UAC and I applied for a few different unis and I got, I think I got paramed on my early entry, I think. And yeah, I was straight school leaver, turned 18 in year 12 and went into my first year of uni 19 last year. So I never really thought about doing paramedicine at all, really. I wanted to study medicine. I went through a lot in year 12 and at the end of it, my ATAR score wasn't the greatest. I got into biomedicine, which is what was basically my dream. And I applied for paramed at Charles Sturt, and just because it was different and it was at the beach, and I don't know, I just last minute decided to go there and I haven't regretted it. I'm kind of using it as a pathway to get to medicine.
Yeah, so I finished year 12 last year and I just went off my ATAR. So I got an ATAR of 90.5 and 80 was required for, I'm in physio at Port Macquarie, and that was just what was required, and that just got me into the course. Originally, I wanted to study medicine, but I didn't get, there's another exam for that called the UCAT exam, and I didn't get a high enough score in that exam to get in, so I went through physio.
I attended the IAP program, which is the Indigenous Access Program. It's a program which allows mature or school leavers to attend uni. One of the students from the university told me about the program and I was encouraged about it, and I wanted to pursue my dream as a nurse.
So I did get into oral health directly via my ATAR from school. So obviously oral health ATAR is a lot lower than dentistry, so it was sort of my pathway into dentistry.
When I was in year 10, I did a work experience week at the Lismore-based hospital, and I kind of thought I'd want to do nursing because both my parents are nurses, or medicine, and I spent a week in the radiology department and I absolutely loved it, and I based my year 11-12 subject selection around helping me get into that. I did biology because, you know, how the human body and everything works. I did PDHPE, which helped heaps with anatomy because you learn all the bones and muscles and that, which has helped a lot. And the subject that helped the most was physics.
With chemistry, I took it in year 11 but dropped it for year 12, and I really wish I had kept it for year 12, knowing now how much chemistry is actually involved in a medical subject. With physio, now that I've gone into the course a little bit, definitely biology and PE, like PDHPE, have been the most useful that I've found.
I was right into the arts and humanities, which is really funny because it was probably not until about halfway through year 11 that I found that I was really enjoying biology. And it was probably the subject that I did the best in, funnily enough.
In terms of getting into dentistry, there's no prerequisite subjects, I don't believe. But I think having a really good foundation in science helped a lot, especially when you start doing biology and chemistry in first year. Having that background really supported me.
For nursing, I highly suggest PDHPE, chemistry and biology. They help a lot.
I did biology, accelerated into biology, and so did year 12 bio in year 11. And I had done sort of chemistry, physics, that kind of thing. And that was, I found, enough to kind of get into the science side of things.
I did PDHPE, which was pretty helpful, and I found it super interesting. And then I did biology, physics, and chemistry for both years. Biology was definitely the most useful. A lot of my first year subjects involved kind of basic human anatomy and physiology, and biology definitely helped.
Dentistry specifically, I would say chemistry was a major help, but even in oral health, biology was foundation, I would say, for a lot of anatomy and just getting you used to vocabulary that you're going to hear.
I think the biggest thing that helped was doing like a week of placement in a hospital in year 10, because in my mind it was kind of just nursing and medicine. I didn't really know that there were all these other aspects of health that you could go into. I didn't really know much about radiography or anything until I did my week there.
Be really nice to your teachers, because they're actually in the forthcoming years you're going to rely on them a lot and figure out, especially in uni and stuff.
You might not end up where you expect to be, but that doesn't mean that what you haven't already done isn't important. So I've gained quite a number of skills taking the long way around, as they say.
I did do some work experience in year 10, although I wasn't fully committed to doing dentistry in year 10. I think that kind of came later on, but having that initial experience really opened my mind to it. Sometimes what you want to do as a profession doesn't come to you straight away, and that comes with time. So for me personally, I think choosing the subjects you love and what you find most interesting will be at your biggest benefit, because if you love what you're doing, you put more effort into it, and with more effort you get better grades and better results, and I think that's what really matters at the end of the day.
One bad assignment or exam or even a subject, it's not the end of the world. You learn a lot more by trying things and maybe sometimes failing at them than you do by being perfect all the time, I think.
Not be so stressed about it, that the HSC is not the be all and end all, and there are so many other ways that you can get to where you want to be without getting that perfect score.
Definitely keep up social life, keep seeing your friends, and use that as a reward in ways. So you try and get your stuff done before that, so you can go out with your friends without having any stress of knowing that you've still got to go home and get stuff done.
No one really is expecting you to know exactly what you want to do for the rest of your life. And I would say small, consistent effort is much more effective than leaving it till the end and cramming.
Don't give up on your dreams, and never let anyone tell you that you can't do anything, because you can do it.